Good evening. We'll start with our session. This is SYJC biology lecture. Name of the chapter is Reproduction in Lower and Higher Animals. We are in chapter 2, part 3. I am Professor Prasad Tamankar. In the last session, we understood male reproductive system in detail, and female reproductive system was left half. So before proceeding to female reproductive system entirely, means remaining part, we should revise something related to histology of ovary. Now, what is histology of ovary that I had told you? Histology actually is nothing but the uh, microscopic structure. We can say microscopic structure of ovary will be called as histology of ovary. How ovary develops, that we have understood. It starts developing in the 9th week, where endometrium surrounding the yolk sac will form regions for ovary. It will give rise to formation of oogonia. Oogonia will unite together so as to form uh, the basic primordial cells, which are covered by certain specialized structures that is called as membrana granulosa. Then later on, the egg nests are formed, and the primordial follicles would be there. Around 2 million will be developed. 50% of that will be undergoing atrasia. Atrasia means death before birth of a baby, female baby, of course, you have to say. Then remaining 60% will die till puberty, and 40% will remain. This 40% will start developing. So here we have got a sectional view of ovary. This we can say are nothing but the primordial follicles. These primordial follicles will start developing again under influence of hormones. FSH will be responsible for it. When FSH increases in the body of female, matured female, of course, what will happen? The follicle will start developing, and there will be a primary oocyte present. Okay, then it will develop a cavity that is called as antrum or antral cavity. The follicle will be called as secondary follicle. देखो follicle को secondary follicle कह रहे हैं हम लोग. Antrum develop हुआ. Okay, then there is a Graafian follicle developed. Graafian follicle के अंदर क्या होगा? Antrum will be maximum, and Graafian follicle is that in which we have got first maturation division complete. So this is a ovum which has underwent stages like oogonia to primary oocyte to secondary oocyte, and then there is process of release of ovum from ovary. This is called as ovulation. So ovum at secondary oocyte stage will be released out. Secondary oocyte का मतलब क्या है? It has underwent only one maturation division, or meiosis 1 only is complete, meiosis 2 is remaining yet. So that's an idea behind it. Then this bleeding body will be called as corpus hemorrhagicum, will reunite or start reuniting so as to form corpus luteum. So this is called as developing corpus luteum. Developing corpus luteum will form corpus luteum. Luteum because it is yellow colored, hemorrhagicum because it is bleeding body. Graafian follicle is the largest one. Okay, and then this corpus luteum will remain alive for around say 14 days so as to keep on secreting a hormone. That hormone is progesterone. After 14 days, corpus luteum will die. Why it will die, we'll understand later on while studying menstrual cycle. And after this, we can say there is a scar remaining on ovary. This is a dead scar of corpus albicans. This corpus albicans will not be able to regenerate again, and that's how we can say are the different stages of follicles. Actually, we can say एक चीज यहाँ पे कहना चाहता हूँ कि जहाँ पे ये प्रीमोर्डियल फॉलिकल है, उसी जगह पे ये सब चेंजेस हो जाते हैं. ओके, ऐसा नहीं कि एक चेंज यहाँ पे बाद में दूसरा यहाँ पे. दिस इज सेक्शन टेकन, सेक्शन ऑफ ओवरी टेकन व्हेन ऑल द स्टेजेस वर अवेलेबल एट डिफरेंट प्लेसेस लाइक दिस. लेकिन याद रखना कि ये सब चेंजेस एक ही जगह पे हो जाते हैं. जहाँ पे ये प्रीमोर्डियल फॉलिकल है वहीं पे वो डेवलप होना शुरू हो जाएगा. तो यहाँ पे पहले प्रीमोर्डियल फॉलिकल था, अभी कॉर्पस ल्यूटियम है. यहाँ पे भी प्रीमोर्डियल फॉलिकल था, डेवलपिंग कॉर्पस ल्यूटियम है. यहाँ पे ग्राफियन फॉलिकल है. सो दिस सेक्शन इज शोइंग प्रेजेंट स्टेट, बट रिमेंबर दैट इन द पास्ट देयर वर primordial follicles at this all particular stages. So this is actually we have to say about. Then we have to understand the remaining part like oviduct. This also we have done. Now what is oviduct? It is also called as fallopian tube or uterine tube. it is a muscular tube that is connecting or arising from fundus of uterus. Uterus is divided into three regions. Anterior portion is called as fundus, middle portion is called as body of uterus, and posterior part is called as cervix. तो ऊपर वाला जो पार्ट है वहां से एक ट्यूब्स निकलते हैं, दो साइड आर्म्स निकलते हैं, दोज आर कॉल्ड एज ओविडक्ट्स. इन केस ऑफ ह्यूमन दे आर कॉल्ड एज, क्या कहेंगे उसको, fallopian tubes कहेंगे. Each fallopian tube will be around 10 to 12 centimeters in length and around 1 centimeter in thickness, lined by three normal layers: outer protective layer, middle muscular layer, and inner layer will be of ciliated epithelial cells and secretory epithelial cells. These secretory epithelial cells will secrete mucus. The arrangement is to allow safe journey and smooth journey of developing follicle, or rather we can say secondary oocyte, from fundus to we can see uterus. तो ये सब करने के लिए इसका जरूरत है. It has got two ends. One end is attached to oviduct, has got two ends. One end is attached to the uterus at fundus region, and second will be considered as free end. This free end will be having a funnel-like structure called as infundibulum. This infundibulum will be having opening that is called as ostium. Then funnel-like structure will be having finger-like projections. Those are called as fimbriae. All fimbriae and internal lining of infundibulum as well as inner lining of oviduct will be lined with ciliated epithelial cells. These ciliated epithelial cells are responsible for collecting ovum as soon as the ovum is being released. Okay, or when ovum is tossed by ovary, it will be collected by this particular structure. Then there is a middle curved portion of oviduct. This middle curved portion will be called as ampulla or fertilization field. Ampulla because it is sac-like structure, fertilization field because fertilization mostly takes place here in this particular region. That's what is called as fertilization field. Then there is a distal narrow end of the oviduct which is known as isthmus or cornea, will be connecting oviduct to the fundus or uterus of the fundus. So these are the different parts of it. Then we have to go for understanding uterus. Now this is a new part. We had completed up to oviduct last time. This is a new part we have to understand. Now what is uterus? Uterus is commonly called as womb. इसे कोक कहते हैं ना. बहुत बार आप लोगों ने हिंदी फिल्म में डायलॉग सुना रहेगा, तो मेरे कोक से नहीं जन्मा है ना. या हिंदी फिल्म में बहुत बार, ये पुराने हिंदी फिल्मों की बात है ना, माँ कहती है अपने बच्चे को, तू नालायक रहा, मेरे कोक से जन्म के उसका कुछ फायदा नहीं. So that is womb actually. Okay, English word is womb for it. Now uterus is the real word, scientific word we have to understand. Uterus will be placed in again pelvis region. जैसे कि हम लोगों ने कहा था ovaries के लिए, ovaries are placed in pelvis region. Uterus also is placed in pelvis region. What is pelvis region? I told you last time. A part of body that is below navel region is called as pelvis region. नाभि के नीचे वाला जो बॉडी का पार्ट है उसको हम लोग pelvis कहेंगे. तो इस pelvis में actually there is a pelvic girdle present. Pelvic girdle का एक joint है, उस joint को कहते हैं pubic symphysis. Pubic symphysis के पीछे होगा फीमेल बॉडी के अंदर uterus. Okay, but before there is an organ available that is called as urinary bladder. So serially कैसे होगा कि pubic symphysis, उसके पीछे होगा urinary bladder, and behind urinary bladder there will be uterus, and behind uterus there will be rectum. So if we go from ventral portion to the dorsal portion in female body, these organs are available in this particular way. So we can say actually uterus is placed between rectum and urinary bladder. अभी उसके ऊपर questions format कर सकते हैं कि urinary bladder is dorsal to. So ऐसा question पूछा तो आपको चार options आएंगे. So it is dorsal to, maybe pelvic girdle, maybe urinary bladder, maybe both A and B, and rectum. So A and B is correct because it is dorsal मतलब पीछे की तरफ, dorsal to pubic symphysis as well as dorsal to urinary bladder also. So both of these are important. Okay. Now this uterus is a very small organ actually speaking. अब ऐसा लगता रहेगा कि उसके अंदर बेबी बढ़ता है, बच्चा बड़ा होता है तो बहुत बड़ा organ रहेगा. No, it is very small organ, almost of the size of one's own palm. फीमेल जो है उसके पाम के साइज का जितना ये यूटेरस नॉर्मल साइज में होता है. ठीक है, अंडर नॉर्मल कंडीशंस. रिमेंबर दिस वेरी वेल. इट इज स्पीयर शेप्ड ऑर्गन. ओके, having a height of around 7.5, breadth of around 5 centimeters, and thickness of 2.5 centimeters. So these are the dimensions of uterus. Can be divided broadly into three regions. Anterior most broadest portion will be called as fundus. This fundus is important for implantation. What is implantation? I told you last time, just mentioned attachment of developing ovum to uterus. Is it? Yes, endometrium of the uterus will be called as, या developing embryo जो है वो uterus को attach हो जाएगा. This attachment of developing organism or embryo to the endometrium of uterus will be called as implantation. तो यहाँ पे mostly implantation यहाँ पे हो जाता है. It is broadest most part. Okay. Then the middle portion actually is called as body of uterus. Okay. अभी देखो फंडस जो है थोड़ा सा डोम शेप्ड है, इसलिए उसका साइज थोड़ा सा छोटा रहेगा ऊपर की तरफ से, बट उसके नीचे जो मिडिल पोर्शन होगा इट इज ब्रॉड and is called as body of uterus. There is a third little portion or smaller portion available. This smaller portion which is tapering will be called as cervix. Cervix is having height, or we can say length, of around 2.5 centimeters, and it is opening into the female copulatory organ. It is called as vagina. Female copulatory organ का मतलब population के लिए जो use होता है उसको कहेंगे vagina. This is done with the help of two openings, internal and external os. Os का मतलब opening होता है. So the opening which is present towards outside will be called as external os, and the opening present towards inside will be called as internal os. Diagram दिखाऊंगा तब उसमें सब वापस explain करूंगा थोड़ा सा. So don't worry right now. So this is how we can say the basics of uterus to be understand, and then we have to understand some other characteristic features. Like uterus is having 3 layers. जैसे हम लोगों ने कहा कि 3 पार्ट्स से यूटेरस बना हुआ है, फंडस, बॉडी ऑफ यूटेरस एंड सर्विक्स. वैसे अगर हम लोग यूटेरस को अंदर बाहर से अंदर देखते जाएंगे, so there are 3 layers available. The most outer layer of uterus is considered as perimetrium. देखो पेरी का मतलब पेरीफेरी में है. That's what is called as perimetrium is layer. This perimetrium is made up of fibrous connective tissue and naturally protective in nature, so little bit rough and tough, but extensive, means will keep on extending whenever there is baby growing inside. Then there is a middle layer available which is made up of myometrium. Layer का नाम है myometrium. It is made up of smooth muscles, and these smooth muscles are thick in nature, and these are again dispensable type of muscle. Dispensable का मतलब क्या है? जैसे कि अपने स्टमक में मसल्स है, these muscles are also dispensable in nature. क्या मतलब होता है dispensable muscles का? Whenever anything is put in the organ will start expanding. So whenever baby starts growing in uterus will start expanding, and these muscles will allow expansion. So that's why they're called as dispensable type of muscles. So this muscle layer will be responsible for stretching whenever there is a pregnancy or gestation phase, as well as these muscles will be responsible for undergoing vigorous contractions and relaxation so as to help in childbirth or delivery or labor. ठीक है, या पार्चुरेशन. सो बच्चे को पैदा करते वक्त बच्चे को बाहर फेंकना है, बॉडी में से एक्सपेल करना है, विशुद्ध से पुश करना है. तो उस पुशिंग एक्शन में एक्चुअली क्या होगा कि ये यूजफुल होगा. कौन यूजफुल होगा? दिस लेयर विल बी यूजफुल. ओके, सो रिमेंबर देयर आर 2 functions. It will allow expansion, stretching, and it will be putting force on the baby so as to push the baby's body out from uterus. Okay, there is innermost layer in endometrium which is made up of stratified epithelium. Now this stratified epithelium is very important because it is capable of undergoing what we can say regeneration quite oftenly. It is highly vascularized, highly glandular layer, and there are the cells available. These cells will keep on dividing and redividing quite oftenly because this layer is lost. Okay, so in a monthly cycle, menstrual cycle, the layer will be lost every month once and will be regenerated. अभी ऐसे क्यों होता है? That we will understand while studying maybe fertilization or implantation. So there is a monthly change occurring in this layer during menstrual cycle. So मैंने जैसे कहा कि ये layer जो है उसका thickness बदलते रहेगा. Normally it is 5 millimeters in thickness, but whenever there is a menstruation, the entire layer will be washed off and the thickness will be reached up to 1 millimeter. Once again it will start redeveloping, regenerating, will become 5 millimeters in thickness. So this is very important, important for formation of placenta, means it will allow implantation. तो ये जो endometrial layer है उसका definition मैंने implantation का definition यही से बताया. It is attachment of developing individual or embryo to the endometrium of uterus. तो placenta formation में जो maternal placenta का part है उसके formation में इसका बहुत अच्छा योगदान रहा है. So remember it very well. This is a diagrammatic representation which will give you entire idea about the uterus, not only uterus but vagina also. Okay, so let us understand what this diagram is. We studied ovaries. So this is one ovary, this is another ovary. Again, as usual, one ovary is shown intact, another ovary is shown with the help of a cut portion. So as to understand this, actually we have understood. Okay, LS of ovary, or we can say histological structure of ovary. Fine. This one structure is oviduct, and this is another oviduct. Remember, this is a pear-shaped organ. This is called as uterus. To the anterior-most portion of uterus, which is called as fundus, the oviducts are attached. So this is the attachment of, we can say. Now here, on this particular side, let us understand certain attachments. Okay, uterus, ovary और ये जो स्ट्रक्चर्स है पूरे ओविडक्ट्स, उसके बॉडी के साथ अटैचमेंट्स के लिए कुछ अरेंजमेंट है. जैसे कि फर्स्ट यू टू अंडरस्टैंड सस्पेंसरी लिगामेंट ऑफ ओवरी. ये सब याद रखना बराबर, ये एमसीक्यूज में पूछा जा सकता है. सो ओवरी इज अटैच्ड टू द बॉडी विद द हेल्प ऑफ सस्पेंसरी लिगामेंट. ठीक है, दिस सस्पेंसरी लिगामेंट इज रिस्पॉन्सिबल फॉर कवरिंग ब्लड वेसल्स एंड नर्व्स. ओके, जैसे हम लोगों ने कहा था स्पर्मेटिक कॉर्ड इन केस ऑफ मेल्स फॉर सस्पेंडिंग टेस्टिस इन स्क्रोटम, वैसे यहाँ पे बॉडी में सस्पेंसरी लिगामेंट होगा. सस्पेंसरी लिगामेंट विल बी attaching ovary or suspending ovary, which will be passing nerves and blood vessels to the ovary for supply, blood supply and nervous supply. Then you could see mesosalpinx kind of connection available here, and just above the ovary you can say there is a mesovarium connection. Mesovarium is connecting ovary to the uterus. Okay, mesosalpinx में से blood supply आएगा और mesovarium उसको uterus के साथ connect कर देगा. Okay, and there is a lower portion called as mesometrium. Okay, here this is mesometrium. These three together will be called as broad ligament. ठीक है, इसको हम लोग कहेंगे broad ligament. So mesometrium is lower portion, then there is mesovarium upper portion, mesosalpinx, mesovarium, mesometrium together will form broad ligament. Then there is ovarian ligament connecting ovary to the uterus. Okay, then this portion is actually uterus, can be divided into three regions as you could see. First is they're called as anterior most portion called as fundus of uterus. It is dome shaped. Remember it. It is dome shaped structure. Then there is a body of uterus. See, this is a body of uterus. Actually, this body is supposed to be broad, but it is almost equal to that of fundus. So, but this is broad because ये narrow हो जाता है ऊपर, इसलिए इसको broad कहा जाएगा. Okay. Then this lower portion will be called as cervix. Okay. And you could see that there are two openings. This opening is called as internal os. This opening is called as external os. ठीक है, तो यहाँ पे internal os labeling किया, यहाँ पे external os किया, and this actually canal is called as cervical canal. So baby will develop over here. We'll have to pass through this, and then will be from outside of the body. Okay, so remember all these kind of structures over here. Then uterus has got three layers, as I told you. Innermost layer is called as endometrium. This will undergo monthly changes. Then there is a muscular layer called as myometrium, and then the outermost layer will be called as perimetrium. Okay, ये जो tough layer बाहर वाला है उसको perimetrium कहेंगे. So that will become wall of uterus. So wall of uterus में तीन layers होंगे, endometrium, myometrium and perimetrium. Question में ऐसा डाल दिया जाएगा कि arrange which is the correct sequence of layers of uterus from outside to inside or from inside to outside. तो उसमें आपको accordingly correct answer देना पड़ेगा. Outside to inside it is perimetrium, myometrium and endometrium. From inside to outside it will be endometrium, myometrium and perimetrium. Okay, remember these three layers very well. So that's an idea. If you would like to have a look at it, just एक बार देख लो. Yes, अभी एक बचा था. This entire structure is called as oviduct. Now this portion is important. इसको हम लोग क्या कहेंगे? Infundibulum, means funnel like structure. यहाँ पे भी है वो funnel like structure, infundibulum. Then there are finger like projections. You could see those finger like projections. Even here there are, but they are in cut form. That's why cannot be seen properly. So those are called as fimbriae. Then this entire structure, bag like structure, curved portion will be called as ampulla. Okay, यहाँ पे देख सकते हो कि sac like जैसा structure बन रहा है, और इसी को fertilization field हम लोगों ने कहा था, because fertilization mostly takes place here in this particular region. Then there is a innermost lining. You could see this innermost lining is having two types of cells. secretory cells that secrete mucus so as to make the inner lining smooth, and there are ciliated epithelial cells which are responsible for beating continuously so as to make the journey of secondary oocyte safe from infundibulum up to fundus. So this is entire structure. अभी इसके ऊपर क्वेश्चंस क्या क्या आ सकते हैं? स्केच एंड लेबल फीमेल रिप्रोडक्टिव सिस्टम, तो ये ड्रॉ करना पड़ेगा 2 मार्क के लिए. इतने सारे लेबलिंग्स की जरूरत नहीं है. अ वेरी गुड डिस्प्ले डायग्राम प्लस 3 करेक्ट लेबलिंग्स इज बेसिक नीड. ओके, या राइट अ नोट ऑन, दूसरा क्वेश्चन आ सकता है, राइट अ नोट ऑन दिस पर्टिकुलर पार्ट, ओविडक्ट और फेलोपियन ट्यूब. राइट अ नोट ऑन यूटेरस. ओके, ये सब क्वेश्चन आ सकते हैं. Fine. So remember this very well. These are the things which we have to understand. Now we have to move on to understand the next portion, that is vagina. Now, so far as vagina is concerned, it is a female copulatory organ. Just in case of male, we said male copulatory organ is penis, and in case of female, it is vagina, the copulatory organ. Copulatory organ is the organ essential for copulation process. Copulation मैंने कहा था पहले कि mating process है. So for mating purpose, it is required. It's delivering sperms, so there should be something receiving end. So vagina is a receiving end for sperms. Penis is delivering end of sperms. Vagina, we can say, is receiving end of sperms. So vagina will receive sperms from penis, of course, from male body. So that is feature. Now vagina will be placed along the median line of the body. So it is considered as ventromedial in position. Okay. Will be starting at the base of cervix and will be opening to the exterior in vestibule or in female genitalia as vestibular opening or vaginal opening or female genital opening. तो इस फॉर्म में ये बाहर ओपन हो सकता है. That is important. So remember it very well. ये first important thing है. Now actually speaking, it is tubular organ and kind of, we can say, thin tube, very thin walled tube, and can be undergoing contraction. Okay, मतलब क्या, it will not remain in the tubular form but it will remain in flaccid form. Okay, turgid form में नहीं रह सकता. Around 7 to 9 centimeters in length and around 1 inch or 2.5 centimeters in width, very thin walled and highly collapsible. देखो यहाँ पे word use किया collapsible, means it will remain in flaccid stage. मतलब दबा रहेगा. ये ट्यूब ऐसे है तो लेकिन ऐसे फोल्डेड रहेगा. इट विल नॉट ओपन. इट विल ओपन ओनली व्हेन इट इज रिक्वायर्ड. अभी कभी कभी रिक्वायर्ड है इस ट्यूब का ओपनिंग. वजाइना विल ओपन सो एज टू डिलीवर द मेंस्ट्रुअल वेस्ट आउट. ठीक है, मेंस्ट्रुएशन में मेंस्ट्रुअल वेस्ट जो है उसको बाहर फेंकने के लिए ये ओपन हो सकता है टेम्परेरीली. एट द टाइम ऑफ कॉपुलेशन इट विल ओपन. ओके, एंड एट द टाइम ऑफ चाइल्ड बर्थ इट विल ओपन. Otherwise, it will remain closed or it will remain collapsible form. In the collapsible form, it will remain so that it will be protected. This has got a outer protective adventitial layer. जैसे कि यूट्रस के 3 लेयर्स है, वैसे यहाँ पे भी 3 लेयर्स होंगे, बट उनके नाम थोड़े से अलग अलग है. यूट्रस में हम लोग कहते थे बाहर वाला लेयर पेरीमेट्रियम, मिडिल वाला मायोमेट्रियम और अंदर वाला एंडोमेट्रियम. यहाँ पे हम लोग कहेंगे एडवेंटिशियल लेयर या थिका एडवेंटिशिया, जैसे हम लोग कह सकते हैं. मिडिल स्मूथ मस्कुलर लेयर विल बी देयर. मीडिया, we can say medial layer or muscularis layer, and innermost mucosal layer. So these 3 layers of uterus we can say are continuous with. Mucosal layer is responsible for non-keratinized. Okay, non-keratinized का मतलब क्या होगा, keratin नहीं होगा उसमें, and it is stratified epithelial lining. It will be responsible for storing glycogen. So that is a specialty of mucosal layer. This opening of, अभी ये जो glycogen है, glycogen will be fermented little bit by certain bacteria and will be acidic condition developed in. Okay, opening of vagina to vestibule is called as vaginal orifice. मतलब जैसे मैंने कहा था पहले कि infundibulum या opening जो है उसका, इसको vaginal opening कहा हम लोगों ने, है ना. तो ये vaginal opening है, उसको vaginal orifice का, orifice का मतलब भी opening ही होता है. Now there is one important thing to be remembered. This vagina will be having a fold of mucous membrane present inside it. This fold of mucous membrane is called as hymen, and this hymen is supposed to be the sign of virginity in case of female. Now what does it mean? till first sexual intercourse, this hymen will remain tight, means intact. Okay, getting me? For, or we can say up till first sexual intercourse, it will remain intact. Later on, after first sexual intercourse, it may rupture. Okay, and it is said that after every pregnancy, the width of this, मतलब जो उसके अंदर होल तैयार होगा एक, वो बढ़ते ही जाएगा, ऐसे कहा जाता है. So depending upon the width of this hymen, width of the aperture developed in the hymen, one can predict about the pregnancies, ऐसे कहा जाता है. Okay, now actually ये तो पुराने हालत थे, because पुराने हालत मतलब पुराने ख्यालत थे. Females, matlab girls, they used to be at home, they were not so active, but nowadays girls even are very much active, like boys, they are roaming out, means bahar ghumte hai kaam ke liye, of course, getting it. So they are also going to schools, colleges, they are running, they are taking part in certain games, they are cycling or they are swimming. So there may be a stretch. What I mean to say is there may be a stretch. Like boys, girls also are running after the buses and trains and catching running trains and buses. So there may be some stress developed on this hymen, and hymen may rupture before first sexual intercourse. ओके, कहने का मतलब ही सिर्फ इतना था कि ये पुराने जमाने में माना जाता था कि हाइमेन इज अ साइन ऑफ वर्जिनिटी. इफ इट इज इंटैक्ट इट इज ओके. अगर ये नहीं है तो वर्जिन नहीं है फीमेल. वर्जिन का मतलब, वर्जिन फीमेल इज दैट हु हैज नॉट अंडरवेंट सेक्सुअल इंटरकोर्स. ओके, सो ये ख्यालात मैं आपको सिर्फ बता रहा हूँ जस्ट टू मेक यू अक्वेंटेड विद द नॉलेज, नथिंग एल्स बिहाइंड इट. ओके, नाउ वजाइना विल रिमेन प्लैकेड, विल ओपन ओनली टू गिव आउट द मेंस्ट्रुअल डिस्चार्ज. इसको भी ओपन होना है. मेंस्ट्रुअल डिस्चार्ज बाहर फेंकने के लिए ओपन हो सकता है. इट विल रिसीव पेनिस ड्यूरिंग, ये मैंने सब बताया था पहले, ड्यूरिंग मेटिंग और वी कैन से ड्यूरिंग सेक्सुअल इंटरकोर्स, एंड विल ओपन वाइड एट द टाइम ऑफ चाइल्ड बर्थ. सो दिस इज कॉल्ड एज बर्थ कैनाल. ठीक है, वजाइना को एक और नाम दिया गया है, बर्थ कैनाल. व्हाई? बिकॉज द बेबी हैज टू पास थ्रू दिस एंड हेंस इट इज कॉल्ड एज बर्थ कैनाल. ओके, सो दीज आर द डिफरेंट structures about the vagina. Now we have to understand external genitalia. In case of female, external genitalia is totally different. Males में external genitalia बना था scrotum और penis से. Here it is called as vulva or perineum. Okay, and this perineum is arranged, or we can say placed, on a raised adipose tissue pad. This adipose tissue pad is called as मॉन्स प्यूबिस. देखो ये सब नाम आपको याद रखने हैं, एमसीक्यूज के लिए पूछे जाएंगे. ओके, क्वेश्चन ऐसे फॉर्मेट हो सकता है, पेडिनियम और फीमेल जेनेटिलिया इज लोकेटेड ऑन, रीजन आएगा मॉन्स प्यूबिस. नाउ व्हाई इट इज लाइक दिस, व्हाई इट इज रेज्ड ऑन मॉन्स प्यूबिस, मतलब ये फैटी पैड का रीजन क्या है? लिसन वेरी केयरफुली. वी ह्यूमंस वेर क्वाड्रुपेडल. पहले हम लोग क्वाड्रुपेडल थे, मतलब चार पैर पे चलने वाले थे. सो अपना जो पेल्विक गर्डल है, वो पेल्विक गर्डल इस पोजीशन में था, पेल्विक गर्डल इस पोजीशन में था, एंड द लिम्स वेर हियर. लिम्स साइड में लिम्स थे. ओके, तो पेल्विक गर्डल भी इस पोजीशन में था, इसको याद रखना है. ड्यूरिंग इवोल्यूशन वी अंडरवेंट टॉर्शन. हम लोग सीधे खड़े हो गए तो पेल्विक गर्डल जो वर्टिकल था वो अभी हॉरिजॉन्टल बन गया है. एंड सो द ऑर्गन्स, सेक्स ऑर्गन्स which were on the posterior most end of the body, the vaginal opening which was very close to the what we can say anus. anus के साथ ही, anus के पास में था vaginal opening, जैसे बाकी के animals में अभी भी रहता है. In case of human also it was like this, but due to torsion it became changed in position, so it came towards inside or towards vertical side of the body. तो anus और vaginal opening के बीच में गैप तैयार हो गया. anus remained to the dorsal side, vagina came to the ventral side. अभी ये वेंट्रल साइड पे एनस आने के बाद देयर वाज अ प्रॉब्लम फॉर मेटिंग. अगर ये अंदर की तरफ रहेगा तो मेटिंग इज नॉट पॉसिबल और मेटिंग विल बी डिफिकल्ट, एंड हेंस देयर वाज अ मॉडिफिकेशन दैट टू मेक द vaginal opening ease during the copulation, it has been raised on mons pubis. Okay, so ये mons pubis को बराबर से याद रखना. mons pubis is a small pad like structure, or we can say adipose tissue fat like structure, onto which the vulva or perineum or female genitalia will be raised. this region will show presence of hairy outgrowth which are called as pubic hair. Pubic hair यहाँ पे रह सकते हैं. Genitalia of female has got certain parts, like there is a pair of labia majora. Labia majora are nothing but the pair of fleshy folds of skin forming boundary of vulva. Vulva जो है external genitalia जो उसकी boundary बनाएंगे. They will protect the inner layers or inner parts of external genitalia of female when not in use. Okay, so they will enclose genital and urethral opening and will keep it safe when not in use. This portion actually is homologous to scrotum. अभी ये यहाँ पे बहुत सारी होमोलॉगी है. होमोलॉगी का मतलब आपको मालूम होगा, organs which are similar in or different organs of different organisms which are similar in structure but different in function. ठीक है, स्ट्रक्चर सेम है, फंक्शन अलग अलग रहेगा. तो स्क्रोटम जिस मटेरियल से बना होता है, जिस टिश्यू से बना होता है, उसी टिश्यू से यहाँ पे आउटर स्ट्रक्चर लेबिया मेजोरा बना है. व्हाई इट इज कॉल्ड एज लेबिया? बिकॉज इट इज लिप लाइक. मेजोरा बिकॉज लार्ज इन साइज. ओके, सो पेयर ऑफ labia majora is the first organ. Then labia minora is second organ. Again, there is a pair of fold of muscular structures available over here. They are called as labia minora. Again, a pair of fold of skin available. This two labia minora, they will these are leaf-like structures and small in size, so are called as labia minora. Posteriorly, they will fuse together so as to form forechitae. Okay. Now you must be remembering foreskin. So this organ forechitae will be homologous to foreskin. What was foreskin? Foreskin was a layer of skin present around glans penis. Glans penis के ऊपर एक layer था skin का, loose layer of skin, that was called as foreskin. तो यहाँ पे females में labia minora जो है उसका posterior end में membranous structure रहेगा. This membranous structure will be called as forechitae and it is homologous to foreskin. Anteriorly, it will converge to form a hood-like structure. Labia minora जो है दोनों ऊपर की तरफ connect हो जाएंगे and that will develop a hood-like structure over that is called as clitoris. So clitoris will be, this is external genitalia. We'll have to discuss it later on. Now clitoris is one more region available. Clitoris actually is a special organ made up of same type of muscles, that is what we can say ejaculatory muscles. Is it? No, erectile muscles as that of penis. So it is a small conical structure, hood-like, as we have said, projection that is present at the junction of labia minora. This is composed of same type of tissue as I told you. Okay, this is highly sensitive to touch. Okay, and is composed of same type of muscles, that is erectile tissue, but it is non-erectile. Okay, getting it? It is having corpora cavernosa pair, corpora spongiosa is being lost. अभी आप लोग बोलेंगे ये सब कैसा है? Why it is same, homologous? तो देखो once again homology. Penis is homologous to clitoris. Now what is logic behind it? See, when the body is being developing in mother's womb, I'm talking about embryological development now. फर्टिलाइजेशन हो चुका, सेक्स डिटरमाइन हो गया है ना. सेक्स डिटरमाइन हो गया मतलब क्या? एग और स्पर्म के ऊपर डिपेंड करता है. एग कंसिस्ट ऑफ एक्स क्रोमोसोम, स्पर्म से आएगा या तो एक्स क्रोमोसोम या तो वाई क्रोमोसोम. सो इफ एक्स क्रोमोसोम इज ब्रॉट विथ स्पर्म इनटू ओवम, देन द फ्यूचर ऑर्गेनिज्म डेवलपिंग फ्रॉम दिस जाइगोट विल बी फीमेल. तो सेक्स तो यहीं पे डिटरमाइन हो गया. एक्स एक्स है मतलब सेक्स डिटरमिनेशन इज डन, दैट इज फीमेलनेस. ओके, लेकिन सेक्स एक्सप्रेस नहीं हुआ है. एक्सप्रेस नहीं हुआ मतलब सेक्स ऑर्गन्स तैयार नहीं हुए हैं. सो दिस जाइगोट व्हेन starts developing, during the development all organs are being produced. For each and every organ a small bud is developed. Okay, so in the pelvis region, initially when the female body is developing, in the pelvis region a small bud is developed. This bud will be for the formation of penis if the body is going to be male body. लेकिन ये तो female body बनने वाली है. So this bud will be developed initially and then it will be regressed. Regressed मतलब उसका growth होने नहीं दिया जाएगा and so it will come back or will remain dormant and this gets converted into clitoris. So clitoris is similar organ or part which is made up of same type of tissue, that is erectile tissue, like that of penis. Okay, and having corpora cavernosa type of muscles present in it. This is, as I told you, made up of erectile tissue, but it is non-erectile. Getting it? So people say that it is essential for sexual satisfaction, but scientifically speaking, it has got no role to play. Okay, so remember this very well. But it is a highly sensitive tissue. Around 8,000 nerve endings are present, is said over there. Fine. Now, last organ or last portion of this will be called as vestibule. Vestibule actually is the opening. Okay, so it is a median depression of vulva. Depression means gap or a cavity available. This is enclosing urethral and vaginal opening. Vestibule actually opening नहीं है, depression है. और इस depression का मतलब एक थोड़ा सा what we can say infold है, cavity है, and within this cavity the two openings are available. One opening is the opening of vagina, that is called as vaginal opening, and other is urethral opening. At this particular place, there is a pair of glands available. This gland is called as urethral, is it? No, Bartholin's gland, homologous to bulbourethral gland. Okay, or Copper's gland. देखो मेल्स में कॉपर्स ग्लैंड थे, उसका नाम था, और एक नाम क्या था उसका कॉपर्स ग्लैंड का, bulbourethral gland. फीमेल में उसका homologous gland है, that is vestibular gland or Bartholin's glands. These glands are not visible actually as such, but it has got same function as that of Copper's glands in males. Males में Copper's gland क्या करता था? It used to secrete mucus secretion prior to sexual contact. Means whenever there is a sexual excitation, this gland, Copper's gland, will start secreting Copper's gland secretion, which will make the penis lubricated. That's what we had said. Now, in this particular case, in case of females, Bartholin's glands or vestibular glands will be doing the same function. Whenever there is a sexual excitation in females, these glands would get active and will start secreting mucus so as to lubricate the genitalia, not only genitalia, but even it will try to lubricate the vagina. Okay, lubrication is essential so as to have ease in sexual contact. Otherwise, there may be rupture due to friction. There may be rupture of the two organs. Both the organs, penis as well as vagina, are very much fragile, delicate organs. So due to extra friction, they may get ruptured and there may be injury. So to avoid injury, our body has made an arrangement. There is a mucus secretion which will lubricate the entire process. So this is, we can say, the structure, external genitalia. यहाँ पे जो structure दिख रहा है, this is called as mons pubis. Then labia majora, pair of labia minora. These are lip-like structures. Will keep the genitalia closed when not in use. This region over here, hood-like structure, triangular, or we can say whatever it is known as clitoris. This is urinal opening or opening of urinary system, and this is vaginal opening of vagina. This is anus. So that is all we can say about the external genitalia. Then we have to go for understanding additional structure, which is actually speaking not having any direct relation in sexual reproduction, but is essential for nursing the baby after birth, and that's why it has been included. मैंने क्या कहा याद रखना बराबर से. अगर पूछा जाए कि which of the following organs has got no direct relation in sexual reproduction, तो उसका नाम mammary gland आएगा. Okay, mammary glands are milk secreting glands. You must be all aware of it. Okay, तो इसका डायरेक्ट कुछ रिलेशन नहीं है सेक्सुअल रिप्रोडक्शन में, मतलब ये कुछ भी नहीं करता है सेक्सुअल रिप्रोडक्शन में, इसका कोई भी रोल नहीं है. बट आफ्टर द बेबी इज बीइंग born, it will be giving nursing or will be giving secretion to nurse the baby. That's what is available, and that's why they're called as accessory glands. These accessory glands are present in both male and female, but develop in female at the time of puberty under influence of female sex hormones. There are two female sex hormones, estrogen and progesterone. You must be knowing it. So under the influence of these hormones, it will start developing, and then it will become active during pregnancy. Okay, under the influence of hormone that is called as lactogenic hormone. Okay, prolactin, and means milk production will start over there, and milk release will be done under influence of another hormone, that is oxytocin. ये बाद में हम लोग को वापस स्टडी करना है, तो उस वक्त मैं बताऊंगा एट द टाइम ऑफ लैक्टेशन. एक पार्ट हम लोग को करना है, तभी हम लोग इसको स्टडी करेंगे. रिमेंबर, मेमोरी ग्लैंड्स आर मॉडिफाइड स्वेट ग्लैंड्स और मॉडिफाइड सुडोरिफेरस ग्लैंड्स. स्वेट ग्लैंड का दूसरा नाम है सुडोरिफेरस ग्लैंड्स. ओके, सो रिमेंबर दिस वेरी वेल. दे आर प्रेजेंट इन सबक्यूटेनियस टिश्यू in the anterior region of the thorax. So not necessary to tell the position. There are round organs or round glands available ranging from around second to sixth rib. Second rib से start होके sixth rib तक ये चलते रहेंगे. During pregnancy, they become active under influence of the hormone that I told you. It is luteotropic hormone or lactogenic hormone, prolactin. So this hormone is important. These are well developed mammary gland, and whenever they are well developed, they will show very definite structure. This definite structure is essential for understanding how and where the milk actually is being produced. Okay, they contain fatty tissue or adipose connective tissue, we can say, that is to fill up the gap. Each breast or each mammary gland को breast भी कहा जाता है, will be divided into around 15 to 20 irregularly shaped mammary lobules. So inside there are lobules available. This mammary lobules will be having alveolar glands, and these alveolar glands will secrete milk. So alveolar glands में से milk secrete होना शुरू हो जाएगा. यहाँ पे इसका स्ट्रक्चर थोड़ा सा रिवील करके दिया हुआ है, वो बाद में स्ट्रक्चर हम लोग देखते हैं, डायग्रामेटिक रिप्रेजेंटेशन. Milk that is produced will be stored in the lumen of alveolar space, and then after this it will open, alveoli will open into mammary tubules. Alveoli का मतलब क्या है? Sacs. Okay, so this sacs will be filled with milk. Milk will be stored over here. These sacs will be then opening into mammary tubules, and these mammary tubules then will unite to form mammary ducts. So initially tubules, then ducts. Okay, which in turn will unite to form mammary ampulla. Ampulla means sac-like structure. Okay, these ampullae are then connected to lactiferous duct, and these lactiferous ducts will converge towards the nipple of the breast. Nipple is the tip of the breast and is important. Nipple is surrounded by specialized dark brown area that is called as areola. So these all structures you should remember. तो पहला क्या होगा? Mammary gland will be filled with adipose tissue. ये जो yellow part सब दिख रहा है, that is actually adipose tissue. So you can see pectoralis major muscles. Muscles है यहाँ पे chest के muscles, उसके साथ ये connected है adipose tissue. Okay, then there are suspensory ligaments available. These ligaments will give support to the mammary gland. Then there are lobules of 2 lobes of the mammary glands, है ना? ये lobules है, छोटे छोटे lobules के अंदर होंगे what we can say ampulla. Is it? No, alveoli will be available. Alveoli के अंदर secretory cells होंगे. These alveoli they will open into mammary tubules. ये अंदर वाला structure होगा mammary tubules. Tubules will then give rise to formation of ducts. Okay, and lactiferous ducts will give rise to formation of what we can say ampulla. Ampulla is this structure. यहाँ पे देखो, ये थोड़े से expanded structure बन रहे हैं, और this ampullae यहाँ पे ये structure को lactiferous duct कहा है. तो यहाँ पे अंदर जो है वो क्या होगा? Mammary tubules. Okay, और फिर ये ampullae, all the ampullae are converging towards this end. This entire portion will be nipple, and a brown area will be called as areola. Okay, so remember this as a structure. इसमें sequence पूछा जाएगा, MCQs में इसका sequence पूछा जाता है कि कैसे होगा. Means give the way in which the milk flows. ठीक है, so you have to remember mammary tubules first. Mammary tubules unite to form mammary ducts. Okay, mammary ducts then form mammary ampullae. Mammary ampullae will open into lactiferous duct. Lactiferous duct will then open into nipple. Okay, so ये बराबर याद रखना. Mammary tubules, mammary tubules के बाद क्या होगा? Ducts. Ducts के बाद ampulla. Ampulla के बाद होगा lactiferous duct, और lactiferous duct के बाद होगा nipple. So this is how the milk will flow. Remember very well, milk is not ready or milk is not produced all the time in the mammary glands. Milk is produced in the mammary glands only under the influence of pregnancy. Whenever a female is pregnant, in the 7th month of pregnancy, the milk production will start under influence of hormone prolactin. Okay. Though milk is being produced, it will not be released till childbirth. तो ये पूरा बॉडी का फिजियोलॉजी समझने की कोशिश करो, बहुत इंपॉर्टेंट है. जो बना है बॉडी, या हम लोग ऐसा नहीं कह सकते कि ऊपर वाले ने बनाया. बहुत बार हम लोग बिलीव करते हैं कि देयर इज सम सुपरनैचुरल पावर, but being a science lecture over here, we cannot say that. But whatever the physiology our body has, it is very fantastic. It is self recurring, मतलब खुद का खुद देख सकती है, of course up to certain limits. Fine, so that is how we can say. तो 3 चीजें याद रखना बराबर. Mammary gland are present in both male and female. They develop in females under influence of female sex hormones during puberty. Okay, milk production will start under influence of hormone prolactin during pregnancy only, and milk will be released during or after the childbirth. We should not say during childbirth, after childbirth, under influence of hormone oxytocin. So these are some specialties about it. Now, after finishing male and female reproductive system, we have to understand the working of reproductive systems, how the working will take place, how the reproductive systems work. For one thing is very sure, I told you, in case of males, the reproductive system is very much complicated to study, but simple to work. Matlab, working of male reproductive system will be very simple. In case of female, reproductive system is little bit simple, but complex to understand its working. Okay, so here are some points which we have to take into consideration. In a boy, what the things are going to happen that we have to consider. So, kaise working hota hai, that we need to understand. At the time of birth, male is said to be immature. Immature means all the sex organs are available in the body, but the sex organs are incapable of reproduction because the process of gamete formation is not yet done. Okay, so ये पहली चीज याद रखना है. So it is immature. Puberty is an important event in the life of humans, ranging from 10 to 14 or 10 to 15 years. In case of females, puberty is a bit earlier. In case of males, puberty is a bit later. So males start maturing at the age of 12 to 14 years or 12 to 15 years. तो ये range है male के maturation का. During maturation, certain changes will take place in the body, and those changes are important. Pituitary gland will be taking a leading role. Now, what is pituitary gland? If you take into consideration, this is a part of brain and this is a lower portion of brain. You could see this green structure. This green structure will be considered as pituitary gland. It is a master gland of body. This gland will be responsible for secreting a hormone. That hormone is called as FSH, that is follicle stimulating hormone. आप लोग बोलोगे ये फॉलिकल तो फीमेल में होता है, मेल में क्या करेगा ये हार्मोन? एक्चुअली ये जो हार्मोन है, उस हार्मोन का नाम सेम रखा गया है, बट उसके फंक्शंस अलग अलग हैं. Follicle stimulating hormone, which will be secreted by this particular structure, will affect on, see this line 1 will be affecting on both the testes. Testes के अंदर होते हैं structure, that is seminiferous tubules. Seminiferous tubules have got German epithelial cells. These German epithelial cells will start producing germs or gametes. Okay, sperms तैयार होना शुरू हो जाएगा इसके अंदर under influence of FSH. ठीक है? Then in response to it, the developing sperms, when sperms are being developing under testes, it will give another hormone. That hormone will be actually hidden, means it is not said always. Okay, so ये hormone जो है, it will give a feedback mechanism. This feedback mechanism will be affecting on to pituitary gland so as to control the sperm production. Okay, getting it very well. So inhibin नाम है इस hormone का. So inhibin hormone will be affecting on it. After this, there is another hormone given by pituitary gland. This hormone will be called as luteinizing hormone or LH. Okay, males में इस hormone को ICSH कहा जाता है. ICSH stands for interstitial cell stimulating hormone. Remember, while studying histology of testis, we studied that there are some cells present between the seminiferous tubules. Those groups or these clusters of cells are called as interstitial cells. These interstitial cells will get affected by ICSH hormone or interstitial cell stimulating hormone or luteinizing hormone, and in response to it, it will start producing another hormone. Interstitial cells will give hormone. That hormone will be called as testosterone. So remember, interstitial cells are affected by ICSH and they produce a hormone, that is testosterone, male sex hormone. Is it clear? Very well. Now this testosterone, as and when it is produced, it will start acting on body, as a result of which the body of male will start designing as a masculine body or body like male. ठीक है, मतलब वो मेल ही है, बच्चा जो है बच्चा है अभी तक ना, बॉय, हम लोग कहते हैं बॉय, बॉय का कन्वर्शन होता है मेल में, बराबर। तो बच्चे के ऑर्गन्स और मतलब बच्चे का फिजिक भी देखो और वेल ग्रोन मेल का फिजिक देखो, थोड़ा सा अलग अलग दिखेगा आप लोगों को, ठीक है। सो दैट इज हाउ इट इज गोइंग टू हैपन. लेट अस गो थ्रू व्हाट इज बीइंग, जो भी मैंने सब कहा वही सब यहाँ पे आएगा. सो एफएसएच विल अफेक्ट ऑन germinal epithelial cells of the testis, as a result of which there will be spermatogenesis starting in testis. Then there will be another hormone given, ICSH, interstitial cell stimulating hormone, which will be affecting on interstitial cells. As a response to it, interstitial cells will produce testosterone. Testosterone is a male sex hormone. Testosterone will help in developing secondary sexual characters. जैसे मैंने अभी कहा कि बच्चे का जो बॉडी है वो पूरा मेल में कन्वर्ट हो जाएगा, तो हाइट विल इंक्रीज, थोड़ा सा मसल्स बिल्टअप अच्छा हो जाएगा, फेस विल डेवलप फेशियल हेयर, वॉइस विल चेंज, देन प्राइवेट ऑर्गन्स आल्सो विल चेंज. ओके, सो वी कैन से द development of penis will be there, development of scrotum will be there. Penis now will little bit increase in size. So बच्चे का जुवेनाइल पेनिस जिसको कहते हैं, बच्चे का पेनिस को जुवेनाइल पेनिस कहेंगे, और अडल्ट पेनिस, देयर इज अ डिफरेंस. One more difference is required. Penis, when it is developing, the prepuce or the foreskin will become loose. Now it is necessary that the foreskin should revert back so as to expose the glans penis. Okay, so armpits पे sweat आना शुरू हो जाएगा. That is one more characteristic feature. Axial hair and pubic hair develop. Axial hair मतलब छाती के ऊपर बाल आएंगे, pubic hair pubic region के ऊपर बाल आएंगे. So these are the changes that are occurring, and the musculature will be developed very well. So all these changes will be considered as changes taking place in a body of boy, so as to convert the body of boy into body of male. Now the real thing is here. When ये सब तो background में होता रहा, ठीक है, when sperm production is enough, sufficient amount of sperms when are produced in the male body, there will be a development, there will be a emotion of sex, or we can say sex stress, sexual stress. Sexual stress कहते हैं, but stress क्यों कहना है? Sexual emotions are developed. Okay, during sexual stress, what will happen? The blood supply to penis will increase. It will become tenfold. Tenfold मतलब 10 गुना blood supply penis में बढ़ेगा. ये हमेशा नहीं होता है, कभी कभी होता है. Okay, penis will change its morphology. It will become little longer, little thicker, will get erected, hard, and now the glans penis will get exposed. Okay, ऐसा जो penis है, this penis will be introduced into vagina during copulation if and when the chance is available. Good words में कहेंगे हम लोग, whenever after marriage, we can say whenever the chance is available, the copulation will take place and penis will be now introduced into vagina, as a result of which the glans penis, I told you, it is exposed because of reversion of, or we can say reverting of prepuce. The semen will be released. Semen will be released. Okay, this release of semen at extreme point of sexual excitation is very important. Release of semen will be called as ejaculation, and the amount of semen that is released is called as ejaculum. Okay, तो ये दो चीजें बराबर से याद रखना. So got this very well? Fine. Now what happens to young males? अभी हम लोग ने तो शादी के बाद की बात कर दी, ठीक है. In good words we are saying, I told you, but we should know what happens to males. कैसे puberty आया males में, कैसे डायरेक्ट थोड़ी ना शादी होती है. So in case of young males at the age of around, we can say 12 to 15, initially during the dreamy state or during the sleep, all these events occur. Means the sexual excitation will be developed during uh, what we can say ड्रीमी स्टेट, नींद में, ड्रीम्स में ये पेनिस एक्साइट हो जाता है, एंड देन देयर विल बी अ रिलीज ऑफ सीमेन इनिशियली, and most of the times the boys, young boys, they will get a guilt of what has happened, ये ऐसे कैसे हो गया, because it is suddenly the semen is released. That's why sex education is essential. तो यंग बच्चों को ये बताना पड़ेगा. अपने यहाँ पे ऐसे फंडा है कि फीमेल्स को तो बताया जाता है, बिकॉज फीमेल्स पे तो मेंस्ट्रुएशन शुरू हो जाएगा, तो फीमेल्स आर टेकिंग, फीमेल्स मतलब बच्चियों को दे आर टेकिंग केयर ऑफ, उनके घर के जो बड़े बुजुर्ग लोग हैं उनको सब इंफॉर्मेशन दे देते हैं, लेकिन ये मेल्स बेचारे भटकते रहते हैं. They will start getting information from their senior friends or maybe from some books and all, but they should be taught very well about this all events. Okay, so this is the first event. So whenever there is a release of semen from body for the first time, male is said to be matured. Very soon this guilt will get converted into alertness, and then there may be a playing with sex organs. This playing with sex organs is called as masturbation, and extreme result of this masturbation is ejaculation. That is possible. Okay, just like humans, apes also can follow masturbation. Masturbation is playing with penis. Okay, as a result of which there may be ejaculation taking place. Just remember these kind of things which are necessary to understand, and whenever you would be a parent, try to convey this information to your what we can say daughters and sons at the right age, at the appropriate age. Fine. So there should not be any confusion. This is a very wonderful thing in our life. Puberty is a wonderful thing in our life, but it should not be spoiled. Fine. With that note, we'll proceed with another thing, that is another structure we have to understand, that is female reproductive system. मेल रिप्रोडक्टिव सिस्टम में तो बहुत आसान था, वर्किंग वाज वेरी सिंपल, है ना. द स्पर्म्स आर बीइंग प्रोड्यूस्ड, एंड व्हेनेवर द टाइम इज अवेलेबल, और व्हेनेवर suitable time, let us say, will be available, under the influence of sexual excitation, sperms are released out from the body. So that's an idea. Now in case of female, again same thing we have to say, females are also immature at the time of birth, though the production of primordial follicles is there in the ovary. The follicles are held in immature state, and that's why the follicles will not be able to release the ovum. Follicle will not be able to release the ovum, and that's why females are immature. Again, in case of females, there will be an event of puberty around the age of 10 to 14 years. So females will get matured. Exactly same thing will happen in females also as that happened in males, but it is little bit complicated because one more organ is involved. मेल्स में कैसे था, पिट्यूटरी ग्लैंड और टेस्टिस, मतलब गोनाड्स इन्वॉल्व थे. यहाँ पे फीमेल्स में पिट्यूटरी ग्लैंड, ओवरीज दैट इज गोनाड्स, एंड यूटेरस आल्सो विल बी इन्वॉल्व्ड, एंड दैट्स व्हाई इट इज ए complicated cycle that is observed in female, complicated reproductive cycle observed in female. उस cycle को हम लोग कहते हैं menstrual cycle. As usual, pituitary gland will take a leading role. Follicle stimulating hormone will be released from pituitary gland. This follicle stimulating hormone will affect on primordial follicles of the ovary. Under the influence of FSH, very few follicles will start maturing. Okay, around 10 to 15, or we can say 15 to 20 follicles will start maturing. Result of this will be the formation of Graafian follicles. तो जैसे कि मेल में हम लोगों ने कहा था कि सेमिनिफेरस ट्यूबल के अंदर के जो सेल्स है, they will start producing sperms. फीमेल में क्या हो जाएगा, primordial follicles will be affected. Primordial follicles are present in ovaries. They will get affected by FSH. They will start developing, not all at the time, but around, I told you, 15 to 20. The most developing, the most fastest developing follicle will ultimately become Graafian follicle. Now, when the follicle is being developing, listen very carefully. Follicle, when it is being developing, it will start producing a hormone that is called as estrogen. We have said earlier also, membrana granulosa cells are master in this. Membrana granulosa cells will start developing around the follicle. They will start producing a hormone. That hormone is called as estrogen. Then Graafian follicle will be completed. Graafian follicle will be broken or ruptured under influence of a hormone LH, luteinizing hormone. Okay, and then luteinizing hormone, when ruptures Graafian follicle, ovum is released and Graafian follicle will be converted into corpus albicans. This corpus albicans will be maintained by luteinizing hormone for next 14 days. In response to this, corpus luteum will start producing a hormone progesterone. Don't worry, मैं बहुत फास्ट जा रहा हूँ, मुझे पता है, लेकिन यही सब हम लोग को स्टेप वाइज आराम से देखना है, ठीक है, in menstrual cycle. Okay, so whenever this corpus albicans is alive or active, it will keep on secreting progesterone hormone. But at a certain time, after say 14 days, what will happen? The corpus luteum will die. So as corpus luteum dies, progesterone secretion stops or progesterone secretion decreases, and that will affect on endometrium of uterus, which will not be able to maintain. So endometrium of uterus will start undergoing shading off. This is called as menstruation. This menstruation means bleeding through uterus when takes place in case of female body for the first time. It is called as puberty has arisen. तो फीमेल को हम लोग कहेंगे उस वक्त puberty शुरू हो गया, puberty period शुरू हो गया. Okay, so whatever I said is said over here. So developing follicle secrete estrogen, puberty gland will now secrete another hormone, LH, luteinizing hormone. LH will affect on ovary and even will lead to ovulation. Graafian follicle will become corpus luteum. This all I have explained you. Corpus luteum secretes progesterone. Progesterone will together along with estrogen help in developing secondary sexual characters in female. अभी females में कौन से secondary sexual characters होते हैं? That also we have studied. The face will become feminine. मतलब दाढ़ी मूछें फेस के ऊपर नहीं आएंगी. Pimples develop हो सकते हैं during puberty in males and females both. Okay, pimples develop होना natural बात है, कोई भी unnatural बात नहीं है. Okay, again armpits में sweat आना शुरू हो जाएगा. Height will increase. Breast development will be there. No change in voice. Menstruation will start. Okay, pubic hair will develop. Axial hair will not develop. Okay, so these are some secondary changes. Of course, the pelvic girdle will become broad. Pelvic space will become broad. So these are the changes occurring in female. The ovum will be released by the what we can say Graafian follicle will be carried to uterus. But this ovum, if it is not fertilized, okay, if ovum is not fertilized, then endometrium of uterus will be shaded off. ठीक है, अभी सीधी बात है ना, यंग फीमेल है, 10-12 साल की फीमेल है, सेक्सुअल कॉन्टैक्ट तो नहीं होने वाला है. सो जो पहली बार मेंस्ट्रुएशन हुआ या होता है, पहली बार मेंस्ट्रुएशन होता है, तब एक साइकिल मेंस्ट्रुअल साइकिल पूरा हो जाता है. रिमेंबर ऑलवेज मेंस्ट्रुएशन इज द एंड ऑफ अर्लियर साइकिल, मेंस्ट्रुअल साइकिल, एंड बिगिनिंग ऑफ न्यू मेंस्ट्रुअल साइकिल. तो menstruation क्या दिखाता है? Whenever there is a bleeding through uterus, it is called as menstruation. It says or it shows that the earlier cycle is over and now it is going to start new cycle, new menstrual cycle. तो earlier cycle में जो ovum release हुआ था, वो ovum fertilize नहीं हुआ. Now ovum being not fertilized, the endometrium will not be maintained and it will start shedding off. That is called as actually menstruation. ठीक है, तो ये याद रखो. अभी आप लोग बोलोगे कि ओवम का फर्टिलाइजेशन होना क्या इंपॉर्टेंट है, तो हम लोग फर्टिलाइजेशन के बाद देखेंगे कि ऐसे कौन से चेंजेस आते हैं. ओके, सो दैट इज फर्टिलाइजेशन इज वेरी इंपॉर्टेंट इवेंट. अगर फर्टिलाइजेशन हुआ तो एंडोमेट्रियम इंटैक्ट रहेगा. अगर फर्टिलाइजेशन ओवम का नहीं हुआ तो एंडोमेट्रियम गल जाएगा, मीन्स शेड ऑफ हो जाएगा, वी कैन से इरोड हो जाएगा, एंड ऑल द डेब्रिज विल बी गिवन आउट एज ए मेंस्ट्रुअम. Okay, so this will be leading to menstruation or bleeding through the uterus. When it happens for the first time in the life of female, it is called as menarche. ये term याद रखना. So menarche is a state where female is said to have matured. Okay, अभी menarche के बाद female का sexual phase शुरू हो जाता है. Okay, means female now will become sexually active, means she can give birth to babies. So 10-12 साल तक इमेच्योर फेज था फीमेल के लाइफ में. अभी 10-12 साल की उम्र से लेके 45, 50, 55 तक क्या रहेगा? matured phase or fertile phase रहेगा, means female will be capable of producing her own babies. Okay, और अभी पहली बार ब्लीडिंग होने के बाद every month there will be bleeding through uterus at least once a month. Initial stages में थोड़ा सा ये irregular होगा bleeding through uterus, but later on it will become normal. Okay, menstrual cycle will be held during the pregnancy. Held मतलब वो रोक के रखा जाएगा, बंद नहीं होता है. And at the age of around 45 to 50, the menstrual cycles will stop. Why? Because at a time around 15-20 ova or primordial follicles will start maturing. After ovulation, the rest of all primordial follicles also will undergo atresia, means death. So as a result, धीरे धीरे क्या होता है, as the age approaches, the number of ova, number of primordial follicles present in the ovaries, they will start atresia, undergoing atresia means death, and there will be no ova or no primordial follicles left in the ovary, and so the menstrual cycle event will stop. This event or this stage of female's life will be called as menopause. देखो यहाँ पे ये वर्ड है menopause, और अभी इसके बाद menopause के बाद female becomes sterile. So we said 3 words in female life. Up to 10 to 12 years means till puberty, female will be called as immature. From 10 to 12 years till 45 to 50 years, female is said to be fertile, means capable of reproduction. Okay, and third stage after 50 years of age or after menopause, whenever it is, so it will be called as sterile. So female will not be able to give birth to her own kids. अपने खुद के babies बना नहीं सकते हैं, because there are no ova left, fine, or no primordial cells left or primordial follicles left. So this entire event, whatever we have explained, ये तो हम लोगों ने puberty explain करने के लिए कहा था, but this entire event will be repeated every month. Now, as this entire cycle will take place within a month or within 28 days, it is called as menstrual. That means monthly cycle. ठीक है, इसको दूसरा नाम दिया गया है ovarian cycle because it takes place in ovary along with uterus and involving pituitary gland. It is called as ovarian cycle also. There are series of periodic cyclic changes taking place between these 3 organs. 3 organs involved है, pituitary gland, ovary and uterus. The organisms which belong to group primates, including human, we are also primates, so it is a characteristic feature. Ovarian cycle is or menstrual cycle is a characteristic feature of primates. Other animals will be having estrous cycle. तो mammals में भी ऐसे cycle होता है, but इसको estrous cycle कहा जाता है. What is the difference between estrous cycle and menstrual cycle? In case of estrous cycle, there is no shedding of endometrium. In case of menstrual cycle, there is a shedding of menstrual endometrium. I repeat, in case of estrous cycle, there is no shedding of endometrium. In case of menstrual cycle, there is shedding of. Okay, so remember this very well. These all periodic changes are completed within 28 days plan. So the name given it as menstrual cycle or monthly cycle. I told you earlier also, one ovum will be released at each menstrual cycle, roughly at the mid of the menstrual cycle on 14th day or 15th day. And one more important thing is, every ovary will give one ovum alternatively. Okay, we have said already earlier, means if left ovary is giving ovum in the month of say January, just for understanding purpose, in the February, right ovary will give ovum and so on. Okay, so they will keep on releasing ovum alternately. The entire interaction between these 3 organs is very important to understand. तीनों organs का interaction हो जाता है. This is what is happening in ovary. Ovary के अंदर क्या changes होते हैं यहाँ पे दिखाए गए हैं. So ovary is undergoing certain things, uterus is undergoing certain changes, and pituitary gland is also undergoing certain changes. ये सबको एक साथ मिला के अपने को pituitary cycle या ovarian cycle study करना है. Okay, it has got 4 phases. First phase is called as proliferative phase. Second phase is called as ovulatory phase. Third is called as luteal phase, and fourth is called as menstrual phase. Listen, menstrual phase is the last phase, end of the earlier cycle. Proliferation means multiplication, reconstruction. So यहाँ पे reconstruction होता है, reconstruction of endometrial wall and reconstruction of new follicles, primordial follicles to Graafian follicle. That's why it is called as proliferative phase. Ovulatory phase, as you know very well, on day 14th, ovulation will take place. So that's what it is called as ovulatory phase. Ovulation will take place. Ovum will be released from ovary. Then afterwards, for 14 days, there will be a phase of what we can say maintenance of corpus luteum. So it is called as luteal phase. As well, there will be maintenance of endometrium in the luteal phase. And last is menstrual phase, when corpus luteum will die and will become corpus albicans. What will happen? The endometrium will be shedded off. So these 4 phases are important. Okay. For study purpose, menstrual phase can be seen from outside or can be marked from outside. Okay. Whenever there is a bleeding through uterus, we can say yes, the earlier cycle has ended and new cycle is beginning. And that's why for study purpose, we will be starting our cycle for study from menstrual phase and will return up to the menstrual phase only. So first stage to study menstrual phase. Menstrual phase, remember, is actually a last phase of menstrual cycle. Now what happens in menstrual phase? अभी जो हम लोग ने सब कुछ कहा है वो सब सिस्टमैटिक मैनर में हम लोग यहाँ पे रखने की कोशिश करेंगे और कुछ नहीं, सेम है, कुछ भी अलग नहीं होगा. So menstrual phase will mark the end of earlier phase. It will last for around 3 to 7 days, generally 4 days. So bleeding through uterus will be there for up to 3 to 4 days. In some extreme cases, it may be 7 days. Okay, it is not a common practice, but up to 7 days it may last. Okay, so the ovum in the earlier cycle is not fertilized. ये तो sure है कि earlier cycle का जो ovum था वो fertilized नहीं हुआ, and so the level of progesterone decreases and prostaglandin level increases, as a result of which the endometrium is not maintained. अभी देखो endometrium को maintain करने का काम progesterone का है. When progesterone level decreases to below normal, what will happen? The endometrium will not be maintained. मतलब उसका thickness maintain नहीं किया जाएगा and it will start rupturing or it will start shedding off. This will lead bleeding through uterus and will be called as menstruation. Menstruation में क्या होगा? It will menstrual flow or menstruum, okay, or menstrual discharge will be given out from uterus. This menstrual discharge or menstruum will consist of blood, then dead tissue, tissue fluid, mucus, and endothelial lining. Okay, and unfertilized secondary oocyte also will be there, but of course it will not be seen because it is very tiny. Size of unfertilized oocyte will be very tiny, so will not be seen, but we have to assume that it is given out. Okay, so the mixture of all this, blood clots, tissue fluid, mucus, endothelial lining, ये जो भी, it's a cleansing process. Remember, it's not something weird, but it is a cleansing process. Uterus will clean itself and will be ready for next cycle. Now, why there is shedding off of endometrium and formation of new endometrium? Endometrium is a very fragile tissue. After formation of endometrium, as the time passes, endometrium will go on becoming hard and tough. If endometrium is hard and tough, then this hard and tough endometrium will not be able to give support to the placenta formation. And that is why in every cycle, endometrium will be lost and will be newly formed. So newly formed embryo of every new cycle will be soft, somewhat glandular, somewhat vascular, and will be capable of giving support for for formation of placenta. तो जैसे हम लोग कह सकते हैं कि अगर सॉइल, जमीन अगर ड्राई है, उसके अंदर पानी नहीं है और कड़क बन गई है, तो उसके अंदर क्या कह सकते, जर्मिनेशन नहीं हो सकता है. तो जर्मिनेशन होने के लिए सॉइल को सॉफ्ट करना पड़ता है, उसमें पानी डाल के उसको थोड़ा सा हम लोग फ्लो करेंगे, तभी जाके वो सॉफ्ट होगा, पोरस होगा, एंड देन जर्मिनेशन इज पॉसिबल. एग्जैक्टली इन द सेम वे द एंडोमेट्रियम हैज टू बी सॉफ्ट, ग्लैंडुलर, वैस्कुलर, so that there will be easy placenta formation. Okay, so that is the reason behind it. Now next we have to understand that around 45 ml to 100 ml blood flow will be there, means blood will be lost, Okay, this blood does not clot due to the fibrinolysin. Blood clots generally नहीं होते हैं, but कभी कभी blood clots हो सकते हैं depending upon individual physiology or individual genetics, we can say. Okay, so is a characteristic feature. Second stage will be called as proliferative phase. पहला phase था वो menstrual phase था. It was degrading phase. Now there is a proliferative phase. Proliferation का मतलब मैंने बताया था. Proliferation is reconstruction. इसको follicular phase भी कहा जाता है. It is actually speaking the first phase of menstrual cycle. यहाँ से menstrual cycle शुरू हो जाता है. So being first phase of menstrual cycle, we can say it will last for around 8 to 10 days. देखो ये सब days भी important है. पहला phase 8 से 10 दिन तक चलेगा. Okay, that is from day 5th to day 14th. अभी हम लोग ऐसे क्यों कह रहे हैं? Because we are saying menstrual phase as a first phase for study purpose. So जिस दिन menstruation दिखा, जिस दिन bleeding दिखा, उसको day 1 माना जाएगा. And all calculations are done on this basis. मैं जो अभी कह रहा हूँ उसको बराबर से ध्यान से सुनो, ध्यान से याद रखो. इसका रेफरेंस अपने को बाद में आएगा while understanding fertilization and pregnancy and development also. तो menstruation का दिन जो है, जिस दिन bleeding दिखा, उसको day 1 माना जाएगा. It is supposed that menstrual phase lasts for 4 days. So from 5th day to 14th day is the second phase, that is proliferative phase. This proliferative phase is the phase during which the level of progesterone is low. Okay, and this low level of progesterone is a signal for pituitary gland to secrete follicle stimulating hormone. So pituitary gland will get active, will start higher dosage or higher concentration of follicle stimulating hormone, and this will start developing around 6 to 12 primordial follicles. 10-12 हम लोग ने 10-15 कहा था पहले, 15-20 कहा था, whatever it is. अलग अलग बुक में आपको अलग अलग नंबर मिलेगा. So irrespective of number, just remember that few primordial follicles will start developing, okay, or maturing. But amongst those, only one will be capable of completely developing endographian follicle. The one which is the most fastest developing and the largest will become the Graphian follicle. Rest all will degenerate by the process of atrasia. I told you earlier also. तो 10-12 फॉलिकल जो चालू हो गए हैं डेवलपिंग होने, इसमें से एक ही फॉलिकल ग्राफियन फॉलिकल बनेगा, बाकी सब एट्रेसिया, बाकी सबका एट्रेसिया हो जाएगा. ओके, नाउ डेवलपिंग फॉलिकल विल रिलीज हार्मोन एस्ट्रोजन. सभी जो डेवलपिंग फॉलिकल्स है एस्ट्रोजन हार्मोन तैयार करेंगे. दिस एस्ट्रोजन हार्मोन विल अफेक्ट ऑन पिट्यूटरी ग्लैंड एंड इट विल अफेक्ट ऑन एंडोमेट्रियम ऑफ यूटेरस. अभी आप लोग बोलोगे एस्ट्रोजन इज अ हार्मोन ऑफ ओवरी, तो ये यूटेरस पे क्या करेगा? इट विल अफेक्ट ऑन यूटेरस सो एज टू कैरी आउट रिकंस्ट्रक्शन ऑफ एंडोमेट्रियल लाइनिंग. देखो ये सब सिग्नलिंग है, स्विच ऑन स्विच ऑफ सिग्नलिंग है. ठीक है, प्रोजेस्टेरॉन लेवल कम हुआ तो पिट्यूटरी ने एफएसएच दिया. एफएसएच से क्या हुआ? ओवरी के अंदर ग्राफियन फॉलिकल तैयार होने का प्रोसेस शुरू हो गया धीरे धीरे. जब ग्राफियन फॉलिकल का प्रोसेस बन रहा था, फॉलिकल्स मैच्योर हो रहे थे, तब मैच्योरिंग फॉलिकल्स ने क्या दिया? एस्ट्रोजन दिया. एस्ट्रोजन क्या करेगा? एस्ट्रोजन पिट्यूटरी को फीडबैक करेगा, वो बाद में बताता हूँ. लेकिन एस्ट्रोजन पहले क्या कर रहा है? यूटेरस के अंदर काम कर रहा है, और यूटेरस के अंदर वाला जो लेयर गल गया था, इरोड हुआ था, शेड ऑफ हो गया था, उसको रिकंस्ट्रक्ट कर रहा है. सो दिस रिकंस्ट्रक्शन ऑफ एंडोमेट्रियल लाइनिंग विल बी डन अंडर इन्फ्लुएंस ऑफ दिस हार्मोन एस्ट्रोजन. ओके, endothelial cells will keep on dividing and redividing. A profound network of blood vessel will develop over there, and endothelial glands also will develop. So endometrium will become smooth, soft, glandular and vascular, so as to wait and give support for the placenta formation. So ये endometrium का development हो जाएगा. The thickness of endometrium will increase up to 5 millimeters. ये मैंने पहले भी कहा था. So that is one more event that is occurring. Now this developing level of endometrium will affect on pituitary gland. उसका रेफरेंस अभी यहाँ पे आएगा. It is third phase, ovulatory phase. What is ovulatory phase? Phase of ovulation. Ovum will be released now from ovary. So ये कैसे आता है? ये phase कैसे आता है? This phase will be one day plan. Means it will take place mostly on 14th day of menstrual cycle. मेंस्ट्रुअल साइकिल के 14वें दिन ये फेज आ जाएगा. इट इज द शॉर्टेस्ट फेज ऑफ मेंस्ट्रुअल साइकिल. What happens exactly? The level of estrogen, as it increases, it will give a feedback to pituitary gland, so that pituitary gland will lower the level of FSH. देखो FSH का लेवल लोअर हो जाएगा और LH का लेवल बढ़ जाएगा. अभी FSH का लेवल कम क्यों होना है? Because if FSH level is maintained high, more and more primordial follicles will start developing. ये नहीं होना चाहिए. यूट्रस में इतनी जगह नहीं है, अपने यूट्रस में इतनी जगह नहीं है, ठीक है. एक ही बेबी ग्रो होने जितनी जगह है, तो एक ही बेबी होना चाहिए, तो एक ही ओवम रिलीज होना चाहिए. एंड दैट्स व्हाई द नंबर ऑफ डेवलपिंग फॉलिकल्स मस्ट बी रेस्ट्रिक्टेड. कैसे किया जाएगा ये रेस्ट्रिक्शन? बाय लोअरिंग द लेवल ऑफ FSH. सो FSH लेवल विल बी लोवर्ड एंड द लेवल ऑफ LH, luteinizing hormone, will be made to increase. This level of LH, when increases, increased level of LH, luteinizing hormone, will affect on ovary. तो क्या हो रहा है समझ में आया? पिट्यूटरी का हार्मोन ओवरी के ऊपर असर करता है, ओवरी का हार्मोन पिट्यूटरी के ऊपर असर करता है, और ओवरी का ही हार्मोन यूट्रस के ऊपर भी असर करता है. ओवरी का हार्मोन एस्ट्रोजन यूट्रस के ऊपर असर कर गया, उसका ग्रोथ कराया अंदर से, है ना. अभी ओवरी के हार्मोन ने फीडबैक दिया पिट्यूटरी ग्लैंड को कि भाई FSH कम करो, LH बढ़ाओ. LH बढ़ेगा तो क्या हो जाएगा? LH will affect on Graafian follicle, and Graafian follicle will rupture so as to release ovum. इस इवेंट को हम लोग कहेंगे ovulation, which will take place on 14th day of menstrual cycle. Okay, then comes next and last stage, that is called as secretory phase or luteal phase. जैसे ही एस्ट्रोजन का लेवल बढ़ता है, हम लोग रेफरेंस ऑलवेज पहले का ले रहे हैं, FSH कम हुआ, LH बढ़ा. LH ने क्या किया? ग्राफियन फॉलिकल में से ओवम को बाहर निकाला. नाउ ग्राफियन फॉलिकल विल गेट कन्वर्टेड इनटू कॉर्पस ल्यूटियम. ओके, तो अभी देखो क्या हुआ. जब ग्राफियन फॉलिकल टूट जाएगा तो बाकी के फॉलिकल्स भी एट्रेसिया फेज में चले जाएंगे, मतलब मर जाएंगे. So now there is no developing follicle. As there is no developing follicle, the level of estrogen will decrease. Estrogen का level कम होते जाएगा. And when level of estrogen decreases, it is a signal once again for ovary to start becoming active and start releasing next hormone, that is progesterone, from yellow colored body. That yellow colored body is called as corpus luteum. Okay. तो LH ने क्या किया? LH secreted by pituitary gland will affect on Graafian follicle. Graafian follicle ruptures, gets converted into corpus luteum. Corpus luteum will start secreting progesterone. Okay. On the rupture of Graafian follicle, the developing follicles also will die. So level of estrogen will decrease. अभी level of estrogen decrease हुआ. Estrogen का काम था reconstruction of endometrium. तो एस्ट्रोजन कम होने के बाद वापस क्या ये गलना शुरू हो जाएगा? नहीं. प्रोजेस्टेरॉन विल टेक चार्ज ऑफ एंडोमेट्रियम नाउ, एंड प्रोजेस्टेरॉन विल मेंटेन द एंडोमेट्रियम फॉर नेक्स्ट 14 days. कब तक रहेगा ये? जब तक एंडोमेट्रियम जब तक LH ल्यूटिनाइजिंग हार्मोन एक्टिव है तब तक. सो LH विल बी सिक्रेटेड बाय पिट्यूटरी ग्लैंड. LH विल बी एक्टिव. LH will maintain corpus luteum. Corpus luteum in turn will start giving or will keep on continuing secretion of progesterone. Progesterone will keep on maintaining the endometrium thickness up to 5 millimeters. तो endometrium को maintain करने का, thick maintain करने का और good condition में maintain करने का काम किसका है? progesterone का है. Okay, so ये सब feedback mechanism है. Corpus luteum will maintain the endometrium lining thick, soft, glandular and vascular. This stage lasts for around 12 to 14 days. Secretory phase or luteal phase will last for around 12 to 14 days, means from day number 15 to the day number of 28. Okay, but now again new cycle is to be start. New cycle कैसे start होगा? तो as the level of progesterone increases, once again it is a signal for pituitary gland to lower the level of LH. ओके, सो देखो ओवरी का हार्मोन पिट्यूटरी के ऊपर काम करेगा, पिट्यूटरी का हार्मोन ओवरी के ऊपर काम करेगा. प्रोजेस्टेरॉन किसका हार्मोन था? ओवरी का. सो इट विल अफेक्ट ऑन पिट्यूटरी ग्लैंड. Okay, so what will happen as the level of progesterone keeps on increasing? It is a signal for pituitary gland to decrease the level of LH. जैसे ही LH का लेवल कम होता है, LH will not be able to maintain corpus luteum. LH will not be able to maintain corpus luteum. So corpus luteum will get converted into corpus albicans, means it dies simply and will remain as a white scar that we have said again and again. So as a result of this, corpus luteum नहीं रहा, corpus luteum से progesterone secrete होता था, अभी progesterone secrete होना बंद हो जाएगा. So level of progesterone will start decreasing. When this level of progesterone goes below the normal, and if the ovum in this cycle also is not fertilized, then once again it will lead to next menstruation. So we have reached to the same stage. So this is a chart actually. ये 3 मार्क का क्वेश्चन हो सकता है. कौन सा? Explain with chart the different stages of menstrual phase. देखो अभी यहाँ पे लोअर लेवल में क्या दिखाया है? स्टेटस ऑफ एंडोमेट्रियम ऑफ यूटेरस. बीच में दिखाया है लेवल ऑफ हॉर्मोन्स और ऊपर दिखाया है चेंजेस इन ओवरी. फर्स्ट फेज ये जो है 0 से लेके 4 दिन तक चलने वाला, इसको हम लोग कहेंगे मेंस्ट्रुअल फेज. सी द FSH level is increasing slowly. All other hormones are at lower level and there is shedding of endometrium and primordial follicles would start developing. Then in second phase, that is follicular phase, what is happening? The level of FSH is high, following that level of LH is also increasing. Okay, and so what is happening? Estrogen is also high. Okay, estrogen की वजह से क्या हो जाएगा? Estrogen, increased level of estrogen will reconstruct this. Okay, and FSH level will start development of the follicles. So Graafian follicle will be made. Now, well, whenever there is a increase in estrogen, FSH level will decrease and LH level will increase. When LH level goes to its peak, there will be ovulation, that is 14th day, third phase, ovulatory phase. Okay, after ovulation, the Graafian follicle will be converted into corpus luteum. Then LH level will start decreasing very slowly. But at this particular time, there is a high level of progesterone. Progesterone will maintain the thickness of endometrium. Okay. As progesterone increases, it is a signal for pituitary gland to lower the LH. So as LH decreases, corpus luteum will not be maintained. It will become corpus albicans. So as corpus luteum becomes corpus albicans, progesterone level will start decreasing and will reach to this stage. So this is all we can say, the entire scenario or cyclic representation of menstrual cycle. This is another view of it. So just as I explained it to you earlier, same thing is there. Now we have to understand the structure of sperm and structure of ovum, but I think so we'll keep it for next time.